Thank you, Pastor Gibson. Members of the Donaldson Chapel Church, it truly is a pleasure for you to open up this moment of time to talk about something that we think is very important. And it's something that's very timely. As a consultant who's been working in the healthcare field for the last 20 years, there's never been more change on the national level, the state level, and especially the local level. When you look at what happened on April 14th, people need answers. So there's a marketing campaign, you'll see things on billboards, you'll see things on sides of buses. But we went to Pastor Gibson and said immediately, come to my church. And I thank you for your leadership, Pastor, to allow us a few minutes to talk about such an important topic. April 14th, Earl K. Long closed his doors after 44 years of operation. On April 15th, Our Lady of the Lake Regional Medical Center stepped in and started taking care of that service. And so to answer questions, we'll be here post-service, follow service, with lots of information to answer your particular questions and to really invite you to understand more about this process, because it may not be today, tomorrow, or next month when you or a loved one may need those services. You need to have that information when that hour comes. And so we're trying our best to get out face-to-face to answer questions, to give information, and to really allow everyone the opportunity to understand what happened, what didn't happen, what's the plan going forward, what's the transition strategy, so on and so forth. And so we'll be here. If you have a business, if you have a place of business, if you have any place that can put information on a bulletin board, we invite you to pass by after service so that we can share some information with you, so that we can spread this information. It's very important, it's very timely, and there's a lot of change. So again, Pastor, I thank you for allowing us this moment. With us this morning is Ms. Coletta Barrett. She's the Senior Vice President at Our Lady of the Lake in charge of mission, and will really give you sort of more information of what happened on April 15th, different from April 14th. Sarah?
Again, thank you very much for opening your home to us, House of Worship. As Perry said, Our Lady of the Lake and the Franciscan missionaries of Our Lady stepped forward to fill this gap created with the closure of Earl K. Long Hospital. I want to be very, very clear that it was a hospital that closed on April 15th. The South Clinic, or the Leo Butler Clinic as it's known, remains open, stays open. When it closed on Friday as a part of Earl K. Long, it opened on Monday morning as a division of Our Lady of the Lake. The Urgent Care Center, the North Baton Rouge Clinic on Airline Highway, still open, never closed its door. The Mid-City Clinic on Foster, never closed its door. The pharmacy there is still open as well. The only clinics that moved were the clinics that were on the Earl K. Long Hospital site. That was the medicine clinic, the medical specialty clinics. Those moved to the Our Lady of the Lake campus. It's the corner of O'Donovan and Hennessy is now where those clinics are located, on the 4th and 5th floor of that new office building that just opened up. And so the bus services still go by, and they have 2 stops there, so still access to the medicine clinics that move. Now, the surgery clinic that was on the Earl K. Long site, if you had surgery and you needed a follow-up, you went to Earl K. Long campus for that. There is a new surgical, it's really not new, but their surgical center that was on Perkins Road has been expanded. They now have 4 operating rooms that are operating, and they have 2 endoscopy labs that are now operating. Those services were not necessarily open towards the end of the transition with LSU. So those services are up and running. I think it's really very important to share with you that the Franciscan missionaries of Our Lady, the nuns that have been here, they've been in the Baton Rouge area for 90 years. And we'll celebrate 90 years of faith and service to the community this year. Their commitment is to treat every individual with dignity and with respect, regardless of your station in life. Our ministry calls us to be a healing and spiritual presence to those in need. We have chaplains on 24 hours a day, 7 days a week at the hospital to minister. It's not just about the physical needs of people. It's also the spiritual and emotional needs of people. To that end, we are working very diligently to be a partner with you all in delivering care. Just in the past month that we've been able to work, no longer are there waiting lines at the Mid-City Clinic for medications. If you've not been there lately, you need to know that Take Your Number is gone. No longer take a number to be called to wait to deliver your prescription. Prescriptions are filled within 30 minutes. And if you forgot to call in your refill, you can still pick it up. They'll fill it in when you show up within 30 minutes. If you ever sought care in the emergency room at Earl K. Long for an urgent care procedure, you may have waited a while. At the North Baton Rouge Urgent Care Clinic that you have information on, from the time you walk in to the time you leave is less than 90 minutes. All of the financial screening policies for Earl K. Long are applied. So if you filled out your papers and you had 100% or what Earl K. Long used to call free care, that is the same thing that you would do now that the clinics are a part of Our Lady of the Lakes Family of Services. So if you qualified for 100% free care and you filled out your paperwork, it's really important, make sure you have your paperwork, you will not get a bill from Our Lady of the Lake. Now, if we mess up and we send you a bill, you call that number and tell them, here's what I have, and it'll be taken care of, okay? The urgent care center that Mr. Franklin talked about is a very, very important aspect or a new service in our community. Prior to Earl K. Long closing, there was a physical asset where people sought care on Airline Highway. And when the hospital closed, people wondered, where do I go? The urgent care clinic is not even a quarter of a mile up the road at the corner of McClellan and Airline Highway. It's open 24 hours a day, 7 days a week. And 70 to 80% of the encounters or the reasons or the patients that went to Earl K. Long's emergency room can access the urgent care center for those same needs. So if you had care continuously in the urgent emergency room at Earl K. Long for your diabetes or for your blood pressure, or there was a reason why you had to go to Earl K. Long emergency room for a follow-up, you need to go to the urgent care center because that is your place that is available. As Perry said, we take very seriously the ministry that we've been called to serve in and to work with LSU Health to extend care. And pray that when you touch our system and our team members are able to minister and walk with you in this journey of health, that you will sense God's presence in us as we minister to those. And we're here to answer any questions after service. Thank you for inviting us into the first question.